How many of you want to be better than normal after a car accident? How many of you want to feel good? Put up your hand. Yeah. Okay, because I've got the amazing, wonderful Janice Lowe here. And she does have a Sunny Boutique in Burnaby. And she helps weekend warriors to keep working and playing hard even during their injuries, because movement heals. And I agree with that. I actually teach classes as well. So,
excellent.
And rest is not always best. So she is going to show us how, which is going to be really fun. So while we're just working on some tech things.
I can start.
She is going to start.
Thank you very much.
Let's give it up to the wonderful Janet. Let's give her a round of applause.
Thank you so much. Well, see after. I'm sure you'll like my talk. We could clap again. So
it's not working with your system.
It's not working? Okay.
You have to do by hand.
All right. So I'm going to advance my own slides here. Okay. So I'm Janice Lowe Physio. As she said, I have a clinic over in Burnaby over there. And today I want to talk to you about some hidden injuries that can happen after a car accident, how to find a practitioner who can help you with those so that you can get back to being better than normal. So who here has actually had a car accident? Okay. Anybody had a recent car accident in the last year? A little bit older. So yeah, you may be wondering, well, yes, I'm a physiotherapist, but what do I really know about car accidents? Well, I will show you. This is me at the top on March 11th, 2011, when I was showing off my new sports car. And then this is me on March 12th on the Sea to Sky Highway when I hydroplaned and flipped my car over at 120 kilometers an hour. So this is actually me right there, buried in the mud. It was quite the day. There was a lot of cars coming, and I was going along, and then all of a sudden there was a stream of water on just outside of Squamish. It picked up my car, it turned it backwards towards the oncoming traffic, and then when I hit the dirt, it flipped it over, and I was watching the rock face, and I was thinking, I'm probably gonna die. But thankfully, it hit on the back, actually. And then there was a pocket around me. So my first thought was like, why is my head wet? It's because all of the windows actually smashed out of the car and my head was in the water from the moat that was there out of the sunroof. And so somehow I ended up getting out of the car and, dealt with my injuries after that. But that wasn't the only one. For some reason, I seem to have a car accident every 10 years. So when I was 25, I was turning left on Knight and 49th, and someone was running through the yellow light and just smashed me at 70 kilometers an hour. And when I was 16, I was driving along at 80 kilometers an hour on a back road, and my boyfriend at the time thought it would be fun to pull the e-brake. And so we flipped over that time too. So here I am, after 3 major car accidents, and if the video is going to play, I want you to know that you can do all the things you love after a car accident, because it might not play today, but it shows a video of me squatting with 150 pounds on my back. I can deadlift, also 150 pounds, and I go skiing, I do roller skating, I play with the kids at the playground and everything. And so I'm going to tell you today how you can be the same. So the way I did it was through physiotherapy and kinesiology. So there's a bunch of things on there that I tried, and there's some that are underlined, and that's because they're the most important. So full assessment is very, very, very important. A lot of times practitioners kind of get an ICBC patient and think, oh, those ICBC patients, they're just going to pretend they're hurt and we're just going to kind of get them out the door. But I know that you can hurt for a very long time. And so if you have a full assessment at the beginning of all of your injuries, then you can ensure that if you don't get better in ICBC's 3-month period, your practitioner can ask for more sessions for you. And also, you need to get all the different things assessed. So not just your range of motion and your strength, but the other hidden injuries And that is why dural and visceral is actually in gold, because those are the game changers for me. So I'm going to go over what those are later on. But what happened to me is I went through hundreds of chiropractic, physio, exercises, acupuncture, massage, everything for years and years and years. And I got to a certain point. I got pretty good. I got to the point where I could go back skiing and things like that. But every time I went dancing or skiing, I would have neck pain for 2 days after. And that's just how I lived. And it was annoying, but that's what I had to do. So one year, I was working at a new clinic, and my friend was getting mentored by the boss. So at that time, they were doing this stuff called dural release and visceral release, and I thought that wasn't a real thing. I actually thought, well, I don't want my boss to know that I think she's doing a pretend therapy here. So one day my friend was working on my neck, and I had about half range of motion and about 5 out of 10 pain in that position. She tried every single treatment that she knew for a full 30 minutes, no change. Then she said, I think it might be your gallbladder. I was like, oh my God, what is she talking about? Gallbladder? Anyways, I said, sure, it's free, I'd try it. So she did some visceral release on me, and I swear, instantly, I had full range of motion and no pain. I was like, oh my God. And then another time I fell and I hurt my finger, and it was hurting for 3 months. I tried everything. I rehabbed the ligament, I rehabbed the tendon, I did everything. I went to my boss, I said, can you look at my finger? It's not getting better. She's like, oh, it's just slightly dislocated. It's not that bad, but just slightly, like you can't barely notice. So she wiggled it around in her little special, fancy, wizardy way. And then within 7 days, it was better. I'm like, okay, I'm sold. So I signed up for all those courses, and now I learned dural and visceral release. I hired her to rehab me, and after that, I got long-term relief from my neck pain. I increased my range of motion by 50% in my neck, even 12 years after my car accident. So you really have to get a proper assessment of all the hidden things that can be there in order to get better, and then find a practitioner who knows how to treat those particular things. So the most important thing is for a practitioner who can actually find the driver, is what we call it. So if you look at this here, the green car is actually Danica Patrick. Danica Patrick. So my nickname is Danica Patrick. So she's here. She's the first IndyCar driver to ever, or first female to ever win the Indy 500. And then now she actually changed to NASCAR just for a change. So with dural tension, which we'll go over later, you can have headaches, you can have a tight jaw, you can have muscle tightness, all of these things. But if you just treat tight muscles, let's say you go for a massage for your muscles, you're going to get pain relief for 24 hours. But then if it's actually the dura that's plowing through and causing the destruction, it's going to come back. So you really need to just treat the thing that's causing the destruction, and then you can get long-term relief. So these are some hidden injuries that are commonly missed by doctors and physios because they do not teach us about these very well in school. In fact, our medical system ignores the viscera and dura altogether, and some people don't even believe that does anything. And then there's the vestibular system, and also, 30% of my patients have a concussion after a car accident, and they have no idea. They just wonder, why am I so tired? Why can't I tolerate light? Why do I get annoyed more easily than before? So dural tension, dura is this red sheath around the brain. It attaches inside the brain and around to the inside of the skull, and it also covers the entire spinal cord. So its purpose is to protect the brain from outside chemicals and things getting into it. But it attaches right here on the skull, and it also attaches right there on the bottom. So it should be like taffy on a hot summer's day. You should be able to kind of move it. It should be flexible. But after an accident, sometimes it becomes more like rawhide. So then you'll feel like you're being tugged, like you can't really get your head down, and you might feel some tension all the way down your back. So can we just try that for a minute? Let's see who has dural tension. Just put your chin, try to touch your chin to your chest. And then feel where the pulling comes from. Do you feel any pulling, or is it just at the top, or does it go down your spine? So show of hands, who has pulling just in the neck area? And then who has pulling down the spinal area when they do that? Yeah, so we have a few there. So that could possibly be dural tension. So there's some specialized treatments for that. It's a very slow, you have to put your hands at the proper place there where it attaches. It's near the surface at that area there. And then you can do a very slow kind of like traction back and forth. And you have to really dial into your touch. So it took me 2 years to develop my touch so that I could actually feel these subtle things, because it's hard. But so after those treatments, that's when my neck started to really relax and it got a lot more range of motion. So visceral manipulation. This viscera just means your organs. That's what it is, all these here. So liver, there's your stomach, there's your intestines. So it's funny that when people go like this, oh, my stomach hurts, they're actually touching their intestines. The stomach is way up here, just like slightly under the ribs. So the viscera, when we see it on a model, all the little organs fit together, right? And they're just snug in there, very nice. Well, actually in our body, they're all suspended by each other by a series of ligaments, and they're all just kind of like hanging in their proper space. They're also the ligaments attached to the front of the stomach and to the back body wall. So if someone has back pain that won't be fixed by chiropractics or massage or regular physio, it could be that the viscera is sitting in one spot and pulling on the back. And that's why if you don't fix the viscera first, then you're just gonna get temporary relief. So this is the liver. So all these arrows are the ligaments. And so you can see it attaches all over the place. The diaphragm, a few to the diaphragm, the anterior abdominal wall, the navel, the colon. So all of these things, when you're in a car accident, everyone knows about whiplash. So yeah, your head goes like that. But what also happens is your whole body goes like that. So all of the viscera actually go back and forth and get their own whiplash. So what had happened to me is that the liver and the stomach got jammed up under my ribs and was pressing on my diaphragm, and was just like that. I just always had some weird tension there, and I didn't really know what it was. It was just the way that it was. And the practitioner said that, and she took about 4 sessions to release it. And a side thing that happened was I had been on prescription acid reducing pills for 7 years. And after those 4 sessions, I didn't have to take them anymore, and I still don't. So that was just pushing everything up. So there's quite amazing things that can happen when you get some visceral release, things that you didn't know were going to change. All right, vestibular dysfunction. So this is the ear, and this is inside the brain. This little funny looking snail thing it has fluid inside these canals here. And then inside those canals is this weird thing here. And so this tells us where we are in space when our eyes are closed. And it helps create our balance, and it helps us to catch ourselves when we're tripping, or it helps us to stay steady when we're going over rocks or sand or hiking in the forest. So this kind of goes down over time with age if we don't practice it. So if we ever practice balance, this is going to stay strong. But sometimes as we get older, that's the reason people have a cane. Not because they're not strong or they have pain, it's because that extra little pressure from the cane tells their brain where they are, and then they have better balance. And so here, these are attached to nerves that go to the brain. And when you tilt your head one way, the watery stuff moves to the side, and it presses on those hairs in a certain way that lets your brain know, oh, my head's this way. And then when it goes to this side, it presses on the other side of the hairs, and that goes to the nerve, which tells your brain, oh, it's this way. So then I can tell where I am when I close my eyes. So if the vestibular system, I actually found that we didn't really talk about it much in school. It's an extra course you have to take, but probably about 60 to 75% of my car accident clients have vestibular issues, and they have no idea that it's from that, and people aren't really checking for that very much, a lot of practitioners. And what it causes is tired eyes, dry, tired eyes. You can't look at your screens for as long as you used to, tired with reading, fatigue throughout the day, because what happens is the ear has to work with the eyes and also the back of the neck. So the back of the neck is impaired as well after a car accident. Those reflexes are not working together properly. Then your eyes have to work extra hard to focus. People can get dizzy when they turn their head or when they lay down and get back up. And so all the system has to work in tandem in a very short time frame, like milliseconds. They all have to work together. So the good thing is that this can be improved through specialized exercises, and it doesn't take very long. It takes about 12 minutes per day, and if someone's willing to do them every day for a certain period of time, if it's a new injury, it could be fixed in 6 weeks. If it's an older injury, it could take a bit longer. It does change. The brain changes itself. If you teach it what to do, how you want it to change, it will actually change and improve itself. So concussion, some symptoms are feeling very irritable, getting angry more easily, feeling sad, not being able to handle noise and light. I had one lady who got a concussion afterwards. She didn't know that she had one, but when she came to me, I noticed the symptoms, and she said, I have to get off the bus halfway to where I'm going half the time, because when people start talking too loud and there's movement and there's noise, I get so mad that I'm gonna hit someone with my cane. So sometimes she can't make it all the way without taking a break. So there are things that you can do to help yourself. For example, you can get a yellow, like a file folder, one of those see-through ones. You can put it on your computer screen, and then that filters the blue light, because blue light is very aggravating for a concussion. So there's lots of tips that someone with concussion training can give you to help you. Also, there's something called neuroplasticity, which is how the vestibular system improves itself, and also concussion. We can do an exercise test in the clinic that finds what heart rate increases your symptoms. And then we write that down, and we get you to exercise at about 10 beats per minute less than that for a certain period of time, a few times a week. And then what that does is it releases a bunch of growth factors in your brain. It goes to those neurons, and it actually helps them to grow new neurons and new connections. So concussion is highly fixable, but it won't be fixed very well if you don't do the right things. So concussion is also a specialized training, as is vestibular. So if you read the bio of the person that you're going to help you, they will say whether they have that training or not. So physiotherapy school is a little bit basic in terms of the treatments that we learn how to do. So afterwards, we have to take extra courses in order to educate ourselves further. That leads me to this: just say no to McDonald's style physio. So I do hear a lot of people have bad experiences at physio, and they think, well, it doesn't do anything. What is it supposed to do? Because my appointment was booked for 20 minutes, but I ended up being there for an hour and a half because I got a hot pack on for 20 minutes, and then I got a TENS machine put on for 20 minutes, and then they forget about me for 10 minutes, and then they give me some exercise sheet, and I do it by myself for an hour, and then the receptionist collects my money on the way home. But why would I go to physio? Yeah, exactly. I wouldn't go either if it was like that. So not everyone is like that, so I want you all to know some people run like that. Sometimes really the big clinics are churning people out, and they have this style going on because the person is treating 6 people at the same time. They're trying to make, good money to pay off their student loans. So I don't agree with that. I never do that. I've actually learned 21 different types of treatments so that I want to be able to help anything that comes into my clinic. And I'm just like really excited about learning about the human body and everything. And I go, oh, I want to learn about that too. And so I take that and I can offer a lot of treatments outside of just machines and hot packs. So I do only one-on-one appointments, full attention the whole time, and also direct billing. So it's kind of relaxing. If you have an ICBC claim or if you have benefits, then you can just come in. You don't even have to pull out your wallet. One thing that I find really, really important if you have an ICBC claim is you need your assessment documented very, very thoroughly. And they need that to have that on file because that will determine whether they are going to approve more sessions later. So they give you 3 months, no questions asked, to have a certain number of treatments. And after that, you have to have documents showing that you had this wrong with you at the beginning. Some of those things have improved, but there's still a ways to go. So then they go, oh, the treatments are working, so yeah, it makes sense for us to pay for more. And then you have to have an advocate. So you have to, sometimes we have to be willing to use our logical reasoning to talk to the adjusters and be like, listen, this person really needs help. They're not faking it. You know, this is why. And if you can really take the time to do that and explain that to people, to the adjusters, they're more willing to give people the help that they need. And so one thing my clinic can offer too is home visits with a kinesiologist. So a kinesiologist is an exercise therapist. They have a 4-year degree in using exercise to help people heal after injuries. And ICBC actually will pay for their travel time to come to people's homes. So I know people are really, really busy and it's a barrier to get out to the gym. So this way you can have, it's like a private personal trainer and they have equipment that they can bring over too. So a little bit about how ICBC works. Like I said, their new way is a little bit different. So they didn't want to, they actually do run out of money. So I know they get a bad rap. We're like, oh, ICBC doesn't want to pay for anything. But actually it takes an incredible amount of money to pay everybody out because there's some, on the snow day, I think there was 200 accidents just in the Lower Mainland on that one day. And so if everybody wants $10,000, $80,000, $200,000 payout, there's really just not enough money. So that's the reason why they, and I don't work for ICBC, okay. That's why they stopped people from being able to sue each other. And so now they say it's no fault insurance, but it's not. They actually find someone at fault. So they determine that from the people's stories, where the damage is on the car, and any witnesses that are there. And then that just simply means whether you have to pay your deductible or the other person does, and whether your insurance will go up in the future. But the great thing is now, for the first 3 months, no questions asked, you can have 25 physiotherapy sessions, 12 kinesiology sessions, 12 massage sessions, acupuncture, chiropractic, and counseling. So people really need to get right on it as the day of the accident. The 3 months starts the day of the accident. And this is all in your brochure, if you've got your brochures that they gave out. And just get on it right away because then they can't say anything about it. There's no convincing it. This is what they're offering. Now, after you've done your 3-month period, like I said, you need someone to advocate for you. You need the practitioner to be asking for more. So they have to take their own free time to write a report to try to get you more sessions. So some people are willing to do that and some people aren't as willing to do that. The other thing is you have to make an appointment with your doctor right away as soon as possible, and you have to get them to document everything. So what I tell people to do is, because our doctors are so busy, you know, first of all, you have to call the receptionist and tell them what it's for, because sometimes they'll book more time. Otherwise, they have 10 minutes for you and it's not enough. You have to make sure you stick with it, you advocate for yourself when their attention is going off, and make sure they write down on their chart every single symptom you have. You want the doctor to have those symptoms on file because they believe the doctor the most. So sometimes when the doctor hasn't examined a certain thing and I've examined a certain thing and I tell them, they say, well, the doctor didn't say it, therefore it doesn't matter. So we need the doctor to work with us and be on board. So I suggest getting the physiotherapy exam first, get a copy of the document, bring it to your doctor. And so sometimes they don't want to look at it and sometimes they do. So hopefully they will. But at least you can have the names of the diagnoses, right? So I write down the names of what I think is wrong, and then you have something to say, because otherwise, you know, people who aren't trained, they go there and you're like, well, I mean, I don't know how to explain it. And then the doctor's like, no time. So if you have that ready, it's a little bit easier. Okay. So does everyone have their phone on them in their pocket? Why don't you pull out your phone? I'm going to give everyone here my free personal injury checklist. So this is, it goes over a little description of everything that I outlined today, so you actually know, you remember what I said and you know what to look for. And then this is the actual checklist that I use with every single one of my ICBC clients. This is only page 1, there's 2 pages. So when someone comes to me, they get like 38 things examined and all written down. So you can take this, and if you have another practitioner, you can bring it and be like, oh, did you check me for this? Did you check me for that? Or do you know how to do it? And go from there. So you know that you're getting the best care that you need. And you can kind of look at these little descriptions and be like, oh, do I have those symptoms? And then see if you might need to get some extra help. So also, everyone here is very welcome to book themselves. If you don't think that you've got a full assessment of your injuries, I have a booth on the very end of this row here. I'm giving free assessments today. I won't be able to go through the whole 38 points today, but you're definitely welcome to come. I can answer any questions you have and take a look at a couple of your parts and see if you maybe need some further help. And then you can also come for a free little mini treatment at my clinic. So I am living proof that you can get back to being better than normal. I ski, I do CrossFit, I play with the kids, I jump around, I literally can do anything I want to do. And I would like everyone to be like that too, because no one should have to be in pain. All right, so we'll open it up to any questions, if anyone wants to know anything. All good. I gave you all the information, now you know everything. Yeah, I'll be available after the show too, just down at the end of the booth there. If you want to have a chat, I'm happy to chat with you. So thank you so much for listening, and have a great day. Enjoy the show. Thanks.
And Janice.